welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with Ije Health at Exchange Place, and my co-host.
Hi everyone, I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of Arunabh Health. Very excited to be here today, Dr. Lazo.
Yes, and today we have a special guest. Dr. Sekhri actually is a hematologist, oncologist, is actually going to be talking to us about some of the hemonc opportunities actually for our patients here in Hudson County.
We're in for a treat. Dr. Sekhri is absolutely phenomenal. I've known him for a while and really brings a breadth of experience in the whole array of cancer care to our community. And we'll talk more about that. We have a lot of questions for him on the range of services we have at Jersey City, on our infusion center and a clinical trial. So I'm really excited to talk with him.
Yeah, I think he's going to break it down for us,
Yes.
go over some of the common cancers, what are some of the signs and the symptoms, And like I said, some of the new modalities that actually, immunotherapy, a lot of the new chemo that's coming out. And again, the academic practice component of it, for patients for trials and so on and so forth. So why don't we do the following? Why don't we go to break and we'll bring our guests right back. We'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Hi everyone, welcome back to Hudson Health. My name is Dr. Angel Lazo. I'm with Ije Health at Exchange Place. Here with our co-host.
Hello, I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of Arunabh Center. Really excited today to have our own hematologist, oncologist, Dr. Sekhri, to talk about really the range of services we have at, for Hudson County from Arunabh Health. So really everything from radiation treatment to immunotherapy to chemotherapy, but not just the treatment, but just the holistic wraparound care for cancer that we have. Plus, we're also going to ask him about the services at our infusion center, the Madeline Fiordani Lorraine Infusion Center, which it's a big long name, but very exciting to have all that for residents at Hudson County. And of course, we're going to ask him about clinical trials and access, which we always do.
Yeah, and this is very important, especially for our community, because cancer is the big, scary word. And again, he's going to break it down to us, tell us what are some of the most common cancers, what is the most common cause of death in cancer, those kind of things, which is the cancer that kills most men, most women, and so on and so forth. And especially, again, the preventive services, what
Yes.
can you do, for example? Do you have a family history of cancer? Is it maybe something genetic? Is it something maybe that you acquired? Is it occupational? So there's a lot of factors when it comes to cancer and how to prevent it, how to treat it. So hopefully he's going to go over a lot of these questions that actually our public may actually have.
I agree, and cancer is one of those things, even as physicians, gets a lot of airtime when they're big celebrities or people who have cancer. But we want to focus on people who don't get help when they have cancer or don't have access to care, and how this institution has really made it their premise to get to a wider group of people, really every member of our community. So we're going to talk to him about, and then the new technologies, that's always fascinating for us, right?
Yeah, and at Ije Health, it's not just about choices, it's actually about options,
Yep.
options that our patients have, standard chemo, radiation, immunotherapy, and so on and so forth. And our team, who's with the cancer designation here actually in New Jersey, we're able to get them involved in trials, get them the latest technology as far as cancer treatment is concerned.
It's interesting you say that because being part of the Cancer Institute of New Jersey really gives us, not just being in Hudson County, we have access to a whole wide array of experts in cancer care that's really world class. So we're very excited about that.
And it's part of the academic practices between RWJ and actually Rutgers. So we're actually very excited to actually have that. So I think we're going to just talk to our guest and find out what's
and then
going
we'll
on.
ask him about different types of cancer, which ones are more prevalent in this population, and what we're seeing for outcomes and treatments. And yeah, I'm looking forward to it, and it's going to be a good conversation.
And it's not just cancer, because they also, you know, they're hematologists as well.
That
and
is true.
hematologists are doctors that basically deal with certain components of your blood, you know, like anemia, iron problems, different things like that, which cancer patients also have a lot of those issues. So the hematologist, you know, deals with the blood disorders, but the oncologist deals with the cancer, no matter where it actually may be.
That's a really good distinction. And part of our questions to him about the infusion centers, what other types of infusions beside cancer treatment do we get in that center? Because it's not just chemotherapy that we have there. So we'd like to hear Dr. Sekhri answer some of those.
Yeah, I'm sure he'll be very delighted to actually go over that with us.
Absolutely.
Okay, so we're going to go to break now, and we'll be right back. We'll be right back.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital, with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer of Jersey City Medical Center, a branch of RWJ Barnabas Health. I'm here with my co-host.
Hi, my name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health. And today we have a special guest.
Dr. Sekhri, will you introduce yourself and tell us a little bit more about yourself, and welcome.
Thank you for welcoming me. My name is Arunabh Sekhri. I trained in New York, and then I went to Minnesota in Mayo Clinic for a few years, which was my job, but I considered it as my second training. And after that, I moved to New Jersey due to my wife. I joined Rutgers because of my interest in clinical research and bringing it close to community.
Excellent, excellent.
That's fantastic. Actually, you know, let's just start off the back. You mentioned clinical trials. Tell us more about sort of clinical trials we have going on with Rutgers, Jersey City, and what our community can know about it.
So we have a cooperation with CINJ, which is the Cancer Institute of New Jersey, and it is one of the leaders in clinical trials. Because of that, we have access to a lot more clinical trials than a general community cancer center. Right now, we have clinical trials in first line in most common cancers like breast cancer, lung cancer, where we are trying to see if we can reduce the side effects of chemotherapy due to new agents like immunotherapy. We have clinical trials against standard of care with targeted treatments. And if similarly in blood cancer also, we have a lot of clinical trials which are using some agents to improve the cure rate of the cancers.
So that means that for our community then, if they don't qualify for, say, the standard of care, they may be eligible for some trial.
It's good you mentioned that, like in colon cancer, if you're out of options, we have 2 clinical trials right in our center in Jersey City.
That's incredible, incredible. Now let's go back a little bit because, you know, the cancer is like a really scary word. And I know we see that now in the news, you know, with King Charles being diagnosed with cancer, even though we don't know exactly what he has. So what are the most common forms of cancer, and how is it different for men and for women, for example? Let's just start from the very basics. So.
In most common cancer in women would be breast cancer, and most common cancer in men would be lung cancer. These cancers have a lot of prevalence, and we have very good treatment now. So people are living much longer. So you will see much more surviving patients with cancer living now.
Yeah, because I'm very old school, and again, doing internal medicine, you know, in the past, I described cancer to my patients as, well, there's really only 2 types. You know, the types that you survive from, And there's the types that you basically try to control, you know, symptoms and increase your quality of life and so on and so forth. How has that changed now, especially with immunotherapy and so on and so forth?
So it's good you bring that up. So previously we used to treat cancer with chemotherapy. And what is chemotherapy? Chemotherapy is a medication which will kill your most actively dividing cell, which is the cancer cell. And because of that, it does come with certain side effects, like it will cause you low hemoglobin, it may cause you fatigue, it will reduce your immunity, it may cause you bleeding. It works well, but it does not work long term, and it comes with a lot of side effects. Now what we have now is something like immunotherapy. So cancer is our own body cell, and it hides itself. The body is supposed to kill abnormal cells with something called T cells. So we have figured a way out by giving something like immunotherapy, which makes the cancer visible to these T cells, and they are able to kill the cancer. When immunotherapy succeeds, sometimes even in stage 4 cancers, we are now thinking that we are curing some people. Similarly, we also have targets. Now, targets are like drivers, the driver which is driving a car, and we have targets which we can give medication for, which acts like brake. And because of that brake, the cancer keeps under control. Example would be something like CML. This cancer used to kill people in 5 years, and now people can have as long life expectancy as everybody else.
Yeah, my understanding is that we're actually getting, even in our regular labs, I mean, I get a call every once in a while, because even on routine CBCs, they're doing flow cytometry and so on and so forth. So I got a couple patients that even some of the leukemias, CML were caught actually very early, you know, and strictly in surveillance, so to speak. And again, this is the importance of actually the preventive services that patients really should take advantage of, because a lot of the cancer is asymptomatic. Some of them we actually detect by accident, either on imaging or on blood work.
And similarly, we are also doing more for prevention. Like colon cancer, only 30% of American population gets colonoscopy, and we could have caught these cancers earlier. So this is a shout out for people to go for your colonoscopy.
Now, what age should they go for colonoscopy? I know those guidelines have been updated recently.
Previously, we used to say 50 years, but now it has gone down to 45 years. It also depends upon your family history. So if you have a family history of colon cancer, you're supposed to get it 10 years after your relative was diagnosed with colon cancer.
Got it. So can we step back a little bit? You talked about immunotherapy and chemotherapy. Can you tell us about the radiation therapy we have and surgical options? So that's part of the suite of treatments we have here at Hudson County for this.
So for surgical option, we have a surgical oncologist and a thoracic oncologist who practices right in our cancer center. One of the unique thing for New Jersey, which this surgical oncologist has brought, he has figured out how to put a pump and give chemotherapy directly to liver. Wow. These things were unique for big academic centers like Memorial Sloan Kettering and now available at Jersey City. And these people who were living for 1.5 years are now breaking 10 to 15 years of their life expectancy due to these treatments. Similarly, he can take out your cancer and can give high-dose heated chemotherapy in the abdomen. In terms of radiation oncology, now we have targeted radiation also available at Jersey City due to the new machine which they have, which is also called SBRT, where they can target the cancer. If the surgeon cannot remove it, it can cure the cancer as good as surgery.
Wow. Wow.
That's very exciting that we have all these innovations for our patients. And we do have a lot of questions. But before we go to break, can you tell us a little bit more about the prevention aspect, and when we come back, we still have a ton of questions for you.
So most important still remains colonoscopy. In women, it remains mammogram. Gynecological cancers are also very important, that a lot of young females do not get their pap smears, and that's why we see much more cervical cancer than we need to. So hopefully people take this and go to the regular doctors and get their surveillance up.
So mammograms, pap smears, and colonoscopies. Very good.
Yeah. I mean, we're very fortunate that a lot of the HPV vaccinations that the Gardasil has been in effect. We're probably seeing, but are cancer rates going up? Are they going down? These are some of the questions we're going to bring you right back. We're going to go to break and we're going to ask you some more questions. We'll be right back.
I've got cancer.
We've got the highest level of cancer care,
the latest clinical trials,
researchers working to find a cure,
and nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments. carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of RWJ Barnabas Health. I'm here with my co-host.
Hi, I'm Dr. Angel Lazo. I'm at RWJ Barnabas Health at Exchange Place.
And we have a fantastic hematologist oncologist, Dr. Arunabh Sekhri. Welcome back.
Thank you for bringing me here. Yep.
So we were talking about the different cancers and the different modalities. You know, we spoke a little bit about immunotherapy. You described what chemotherapy is, the old medicine, and so on and so forth. But let's talk about some of the surgical procedures, you know, some of the surgical options that are involved with patients with cancer. Can you elaborate that? It's a little bit confusing sometimes with patient, like when do you do chemo, when do you do radiation, who comes first? What about the surgical options? Let's talk about some of the surgical options for cancer patients.
So at our cancer center, the advantage is that we sit together. So the surgeon is with us and the radiation oncologist is just across the street. And we have weekly tumor boards where we discuss the case when we have to go chemotherapy, radiation, before surgery or after surgery. We do have a surgical oncologist who is a specialized cancer doctor in pancreatic cancer. So he can do procedures like Whipple surgery, which can be done only at major academic centers. As I mentioned before, he can do heated intraperitoneal chemotherapy after taking cancers out in certain cancers, which is successful only in certain cases. So we have to decide that together as a group. He can also do a pump, which can give chemotherapy directly to liver. We have a thoracic oncologist who is a specialized doctor in lung cancers and esophageal cancers. He's also able to do minimally invasive surgeries with his robot. We have a gynecologist oncologist. In fact, we have two of them who can do all the surgeries available for gynecology oncology. Now, these doctors are also supposed to help us direct the chemotherapy for the patients. So we help them out with chemotherapy here. We have a new breast surgeon who is very, very good in breast surgeries. And if you have a good breast surgeon, sometimes your surgery can become less and less toxic, and they have less side effects like lymphedema, which was a big problem in the past. We do have supportive care in terms of physical therapy for lymphedema also.
So it's great that we have all the subspecialties and really, like you said, a collaborative, interdisciplinary team. But what could a patient expect coming in with cancer? Obviously, any diagnosis of cancer is devastating. We spoke in the last segment about cancer being in the news with King Charles. But what would a patient in our community expect with a new diagnosis? Just walk us through their continuum of care.
So cancer is quite scary news. So you want the patient to come as soon as possible. So we have made our offices easily accessible to the patient. We don't care about your insurance status. When you come in, you will see all the doctors as needed. We will do once a week tumor board, so we will have a multidisciplinary plan for you. We have all the nurses available for all types of infusion as needed. Another advantage we have due to our cooperation with CINJ is that in certain cancers, we can do the specialist tumor board and we can get their opinion, and if they have something better than us, we can cooperate where you can do some specialized treatment over there and some local treatment with us.
That's incredible. So you mean to tell me that in Hudson County, it's not just one cancer doctor that you get a whole team.
Yes.
It's presented before a tumor board, a whole academic, so that's incredible. So it's not really just one doctor. They're basically seeing a team approach.
Cancer has become complicated and we all need teamwork approach.
Well.
So let's talk about the main cancers we see: colon cancer, GI cancer. Tell us more about the outcomes and the treatments we have. Those are becoming more prevalent, like you mentioned.
So colon cancer is becoming more curable because a lot of people are getting colonoscopies and they're finding the cancer at an earlier stage. Previously, for certain cancers, we used to give chemotherapy to everyone. Now we have a blood test, and if we can find the cancer in your blood, then we may give you chemotherapy. If we don't find the cancer in your blood, you may be able to skip chemotherapy. In addition, if your cancer is a little more spread, sometimes we can combine chemotherapy with immunotherapy, which is actually a clinical trial available to us, and we are seeing much better outcomes in those patients.
Now, in my patient population, for example, with colon cancer screening, I offer them the Cologuard. So what are the indications, say, for example, who would you target Cologuard and who, for example, Cologuard may not be for them? they should basically see the gastroenterologist and get a colonoscopy and so on and so forth. So can you elaborate a little bit about that?
Cologuard is an excellent test. So the purpose of Cologuard is to pick up gene. And it may pick up your colon cancer, and it may pick up some other cancers, which is called gastrointestinal stromal tumors, which can also be picked up by Cologuard. Colonoscopy advantage is you can pick up a polyp. If you remove the polyp, it does not become cancer. So for all young people who have no medical problems, ideally they should get colonoscopy, because if you kill the polyp, you will not have a cancer. Cologuard, you may pick up at an advanced stage and you may require chemotherapy after removing of cancer. But it's still a good test for people who cannot get colonoscopy, and a lot of people do not like the preparation for colonoscopy. So it's still better than nothing.
Yeah. And I believe there's actually a blood test that's going to come out that's probably going to replace Cologuard instead of actually having to send you a stool. I believe it was supposed to come out last year, but it hasn't come out yet. So as soon as it comes out, we're going to let our Hudson County patients know, that's for sure.
Yeah, it's supposed to pick up even more cancers.
So really fascinating. Tell us more about the infusion center, the Madeleine Fieldani Laroff Infusion Center we have at Jersey City. What kind of services do you have in addition to your whole set of cancer services?
So infusion center does allow us to give chemotherapy and immunotherapy. In addition, we also practice hematology. So we give a lot of iron infusions to people who are bleeding. We can also give some vitamins over there. In addition, this infusion center is also available to other specialists like a rheumatologist who may be giving their medications there, a gastroenterologist for inflammatory bowel disease to reduce your diarrhea and bleeding. And similarly, they're available to pulmonologists for their asthma medications. So infusion center is not just limited to hem-onc, it's available for other services too.
But the oncology services obviously encompasses hematology as well, you know, because especially with a lot of the cancer treatments, whether it's radiation or chemo, you end up with a lot of blood disorders, and, you know, reversible or not, you know what I mean? So they get the full package. They get the oncologist, the hematologist with the whole team, including the center for the cancer center from New Jersey.
Absolutely. And before we go, I do have to ask you, because it's so important, as you mentioned, cancer is scary. What kind of emotional support do you have for patients who are diagnosed with cancer?
So cancer patient goes through different emotion, which is unique to every cancer patient, as unique is their cancer and their treatment. And everybody will react differently. I've been also on the other side. So I have learned from that, and I'm also always available to my patients. In addition to verbal thing, which we tell, they are going to forget that. So due to Rutgers, we have a lot of literature available in simple information for patients, which is easy to understand. We give it to them, and I think that is very important. When we tell them about their treatment, all the information about the side effects is also available to them. In addition, we are available to them. Another thing which is very, very important is many chemotherapies still cause a lot of hair loss. So we have something called a cold cap, which can reduce hair loss for certain type of cancer patients. And that helps with their emotions. We have social worker, as cancer is a family problem too. So she will help them with their family issues. They will also find whatever resources are available through their insurance and through local counties. In addition, we have something very unique to New Jersey called Nurse Navigator. That is their point person. So it helps them to go through different labs, different imaging, different specialists in case they need to get second opinion. So she helps them set it up. In addition, they give their cell phone number out. So they are available to the patients if they cannot reach the normal line.
Well, we can't thank you enough for coming in and explaining all this to us. And thank you so much for what you're offering, not just to the residents of Hudson County, but also to all the residents here in New Jersey.
Thank you. Thank you for inviting me.
What a pleasure to have you, Dr. Sekhri. Thank you for all you do for our community.
Thank you so much.
Thank you, Dr. Sekhri. And we're going to have you back, I'm sure.
Okay. Thanks.
Thank you very much, and we'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back, everyone, to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of RWJ Barnabas Health. And I have with me my extraordinary co-host.
Hi, my name is Dr. Angel Lazo. I'm with RWJ Barnabas Health at Exchange Place.
So it was such a treat to talk to Dr. Sekhri. What a calming presence and just a quintessentially good physician. Excited to have him here and talk about all things cancer care, right?
Yeah. And again, the cancer is a big scary word, but his demeanor was actually incredible. But the information that he gave us, and especially for our Hudson County residents, it's incredible. It's a multidisciplinary approach. Cancer is very unique. When you have cancer, it's you that we're talking about. And again, every individual, especially with cancer, is different. Different comorbidities. The doctors need to identify what kind of cancer you have. We typically do that through tissue. And then depending on the kind of cancer you have, where it is, they stage you, and then they do your treatment plan. And again, this whole comprehensive special cancer treatment and their affiliation academically with Rutgers and the Center of the Cancer Institute of New Jersey, it's an incredible amount of information and treatment and so on and so forth that we're able to actually offer here in Hudson County.
I like that, but something he also said, which was very important, was the importance of prevention. Colonoscopies, mammograms, and pap smears for women, and getting that done at a reasonable time period prevents many cancers or catches them early enough where it's easier to intervene. So it's very interesting. And of course, we have those services available as part of this comprehensive cancer care.
And again, a lot of the screening, what I mean, is routine. We emphasize that to our patients. We have the hospital at Jersey City Medical Center. We have several satellite offices, like our new one, Hoboken office, that does screening, GYN, so on and so forth. So very important for our patient population to understand the cancer rates, to understand what cancer means to you. Cancer is a comprehensive medical approach. We have all the tools, and we have all the science, and we have all the doctors right here in Hudson County that can take care of you.
And we have all the emotional support, right?
Yes.
He ended up with that really moving segment where he talked about all the wraparound support we have for families, for anyone who's lost a loved one to cancer, how emotional a journey it is. So it was very exciting to have him.
Very exciting. And again, cancer's in the news with King Charles.
It is.
And eventually we will find
and
out.
we wish him the very best.
We wish him the best. And again, we wish all our Hudson County residents the best, and we'll see you next time here at Hudson Health next week with a new subject and a new topic. Thank you very much for joining us.
Bye now.